Your heart has been beating for more than 60 years, without rest, without vacation, without complaint. But what if some of the pills sitting in your medicine box are quietly putting extra pressure on that heart every single day? Many seniors trust their prescriptions completely, and yes, most medications are life-saving. But cardiologists often warn that certain commonly used pills can increase the risk of heart attack or stroke in older adults, especially when taken long-term in high doses or combined with other drugs. Today, let's talk honestly about 5 types of pills that may raise cardiovascular risk in the elderly. This is not to scare you. It's to help you ask better questions and protect your heart. First are certain painkillers known as NSAIDs, like ibuprofen and diclofenac. Many seniors take them for arthritis, back pain, or knee stiffness. They seem harmless because they are available over the counter. But regular use can raise blood pressure, cause fluid retention, and increase strain on the heart. In people with existing heart disease, or even mild high blood pressure, these drugs may increase the risk of heart attack or stroke. The risk becomes higher with long-term daily use. Occasional use may be fine, but daily dependence is where the danger grows. Second are some sleeping pills and sedatives, especially benzodiazepines. As we age, sleep becomes lighter, and many seniors struggle with insomnia. These medications can slow brain activity, but they can also lower blood pressure suddenly, cause dizziness, and increase the risk of falls. More importantly, they may depress breathing and strain the cardiovascular system in vulnerable seniors. Falls and fractures themselves can trigger serious heart complications in older adults. Third, certain decongestants found in cold and flu medicines can be risky. Ingredients like pseudoephedrine constrict blood vessels to relieve a blocked nose. But that same narrowing effect can sharply raise blood pressure and heart rate. For a young adult, this may not be a big issue. For a 70-year-old with stiff arteries, it can trigger chest pain, arrhythmia, or even a stroke. Always check labels carefully before taking over-the-counter cold remedies. Fourth are some diabetes medications that may increase fluid retention in specific patients. While blood sugar control is critical, certain older drugs in this category have been linked to worsening heart failure in susceptible individuals. Not every diabetic medication is dangerous, but if you already have heart failure or swelling in your legs, your doctor may need to review your prescription carefully. Fifth, certain hormone therapies, particularly estrogen-based treatments used after menopause, have been associated with an increased risk of blood clots, stroke, and heart attack in older women, especially when started late in life. Hormones can affect clotting factors and blood vessel function. For some women, the benefits outweigh the risks. For others, safer alternatives may exist. Now, here is something very important. Never stop any medication suddenly without speaking to your doctor. The danger is not just in taking pills. The danger is in taking the wrong pill at the wrong dose for the wrong duration without proper monitoring. As we age, our liver and kidneys do not process drugs the same way they did at 40. Medications stay longer in the body. Side effects become stronger. Drug interactions become more common. A pill that was safe 10 years ago may not be ideal today. So what should you do? First, review your medication list with your doctor or pharmacist at least once a year. Bring every pill bottle, including vitamins and herbal supplements. Many heart risks come from combinations, not just single drugs. Second, monitor your blood pressure regularly at home. If you notice sudden increases after starting a new medication, report it. Third, avoid self-medicating. Just because something is sold without a prescription does not mean it is harmless for seniors. And finally, focus on the foundations of heart health: balanced nutrition, light daily movement, good sleep, stress control, and proper hydration. Medications should support your health, not quietly undermine it. Your heart has carried you through decades of memories, struggles, and victories. It deserves protection, not hidden stress. If you are over 60, take this as a gentle reminder. Be curious about what you swallow. Ask questions, read labels. Have open conversations with your healthcare provider, because sometimes protecting your heart is not about adding another pill. It's about understanding the ones you already take.